Research shows 65% of nursing errors result from poor clinical decision-making, and 50% of novice nurses are involved in those errors of nursing care. Are entry-level nurses making the right decisions? At NCSBN, we are dedicated to assessing and adapting to the rapidly evolving healthcare environment. We know that the next generation of nurses will need to make more complex decisions about client care. To meet today's client needs, improved measurement of the nurse's clinical judgment is critical. That's why we're developing next-generation NCLEX. Clinical judgment is a combination of critical thinking and decision-making. To evaluate clinical judgment, the next-generation NCLEX examination questions will focus on interactions between nurse and client, the client's needs, and expected outcomes. Experts in the latest testing techniques and technology worked with expert nurses to provide cutting-edge solutions on how to best create a test around this model. The Clinical Judgment Measurement Model is a framework designed for testing. It complements the nursing process and other evidence-based nursing theories or practice. To best explain the next-generation NCLEX exam, we simply have to look at examples of these new types of questions. Once you see them, it's very clear how they reflect real-world nursing care. Each uses realistic scenarios or case studies like you would see in a typical nurse-client interaction and focuses on the types of decisions nurses will have to make in a clinical setting. Extended Multiple Response. Extended multiple response items allow you to select one or more answer options at a time. This item type is similar to the current NCLEX multiple response items, but with more options. Extended Drag and Drop. Extended drag and drop items allow you to move or place response options into answer spaces. This item type is like the current NCLEX ordered response items, but not all of the response options may be required to answer the item. In some items, there may be more response options than answer spaces. Close or drop-down. In close or drop-down questions, you can select one answer option from a drop-down list of words or phrases and can be found within tables or charts. Enhanced Hotspot. Enhanced Hotspot items allow you to select the answer by highlighting predefined words or phrases. These types of items allow an individual to read a portion of a client medical record and then select the words or phrases that answer the item. Matrix Grid. Matrix Grid items allow you to select one or more answer options for each row and/or column. This type of item can be useful in measuring multiple aspects of the clinical scenario with a single item. These new item types provide the nursing student with a fidelity-based exam, reflecting the complexities of clients in a variety of healthcare settings. As you can see, the next-generation NCLEX is an exciting enhancement to an already rigorous exam, using the latest testing techniques to maintain the high level of reliability and accuracy of the NCLEX while meeting the changing needs of nursing regulation, public safety, and healthcare. It's all about protecting the public and achieving the best outcomes for clients, nurses, and institutions.